Good morning, everyone, and thank you for joining us for the University of Arizona Campus Update. I'm Holly Jensen, Vice President of Communications, and as always, I'm joined today by Dr. Robert C. Robbins, President of the University of Arizona. He's going to provide important information on our current status due to COVID. He's also joined by Dr. Richard Carmona, 17th Surgeon General and Distinguished Professor Laureate here at the university. Dr. Carmona is going to give you some updates on the current state of COVID and our public health conditions here in the county and in the state and here on campus. We'll take your media questions at the end of today's briefing. Please make sure you type your name and news organization into the window when you raise your hand, and I'll call on you in the order I receive them. Over to you, President Robbins.
Thank you, Holly. I always ask this, do we have any idea how many of these we've done?
I have no, but I'm going to count for us. I would guess in the 60s now.
60s? Okay. Well, we've got a ways to go. Hopefully we don't reach 100. Well, good morning, everyone. Thank you for joining us today. Since our previous briefing on February 7th, we've seen a significant decline in the daily average of new COVID-19 cases in Arizona and indeed nationwide. While daily infection rates are not where we want them to be, the change is a significant improvement from the peak we saw in late January. Dr. Carmona will share more details on this change and how to understand it in a few moments. Hospitalizations are declining as well, and the availability of ICU beds is improving. As we've discussed many times, this is important not only for our ability to care for COVID-19 patients, but also for the healthcare system's capacity to meet other health needs of our community, like elective heart surgery, elective hip replacement, and on and on. This is a move in the right direction, and I'm cautiously optimistic for what we will see in the weeks and months to come. In particular, for the healthcare system, I hope that we will soon reach a respite for our physicians, nurses, technicians, and other healthcare professionals who have worked so hard over the past 2 years. And Dr. Carmona and I have talked about this frequently. Even before the pandemic, there was a significant burnout in healthcare providers. And certainly with the pandemic, as in all sectors of society, there's been an unbelievable toll on the mental health and of all of the citizens of the world. But the healthcare providers have been on the front line of this. And so the hope is we're going to get a break for them sooner rather than later. So to sustain this decline in cases and to help ward off another surge, we need to remain diligent and use the tools we have: vaccination, wearing face coverings indoors, testing, hand washing, and staying home when you're sick. For the university community, this is especially important as we approach spring break. For any students or employees planning to travel, please make sure to get tested both before and after your trip, and wear a mask when needed. In addition, as much as you can, be aware of the public health conditions in the locales you visit and take appropriate measures to protect yourself and those around you. As a reminder, we have various testing options available to the university community. Again, if you're traveling, please consider making an appointment before spring break starts and at the end of next week. And as always, if you have not been vaccinated, please consider making an appointment today. Students and employees can make appointments through Campus Health, and additional locations can be found at vaccines.gov. Dr. Carmona will share recent data and offer comments, and then we'll move to questions and answers section. So Rich, thanks for moving over to the data, and I look forward to our discussion once you're finished.
Thank you. Good morning, everybody, and pleasure to be with you again. As the president has said, things are changing slowly. But I wanted to give you some perspective before we look at the slides. If we look at the United States, we're approaching 79 million cases and also approaching 1 million deaths, about 935, 940,000 now. So It is very, very significant. This is truly a pandemic. In the state of Arizona, about 2 million cases, again, approaching 2 million with about 28,000 deaths. And our 7-day average is about 2,400 cases. That's still a high number. As the president said, it's starting to look better, but there's significant challenge out there and still significant transmission. In Pima County, we've had 248,000 cases approximately with about 3,600 deaths, and our 7-day average is about 388. Still high, but good news is it's trending in the right direction. So let's go to the first slide so we can discuss a little further some of the metrics that we look at. So if we look at our 7-day rolling averages, where we're at with Arizona being 34th or 23rd highest in the nation, it shows that, again, little improvement, but we still have a ways to go. We're about the same as California right now, where California's at 33. If you look at the Northern Mariana Islands at 299, significantly higher. You look at Pima County, California, and Arizona, we're about the same, at the same number there. So national average being 31 and Maricopa being 32. So we shouldn't get complacent, but as the president has said, we're heading in the right direction, but we want to make sure that we're not getting complacent, because even though we do have a few more beds and we have a few more ventilators and we track those every 24 hours, the president gets an incident summary. People are exhausted. Our healthcare providers are leaving. They're exhausted. We've been at war for over 2 years now. So there's a lot of factors that we have to consider before we just arbitrarily say, let's go back to normal, whatever that normal is going to be, because we're still in a problematic situation, although getting slightly better every day. Next slide. So we look at our testing results. You'll notice the remarkable drop in positivity. We were way up before and now at 1.7, 245. And then if we look at our total testing window with well over 100,000 cases at 4.3, still it's a little high. But again, if you look at the trends over the last meetings we've had here and what we look at every day, these numbers are decreasing. What they're telling us is less transmission in the community as we look at these particular numbers. But not enough that we should be complacent, not enough that it's behind us yet. We're still in the midst of a pandemic, but we're gradually moving away from it. Again, one of the things that we don't know and we are concerned about a third of our country and a third of our state is still not vaccinated. And that presents a risk to them and us. In addition, the more people that aren't vaccinated, the more likely it is that that virus finds a home temporarily, and we end up with more mutations, which give us variants, which can be problematic, such that they could be more transmissible, they could be more lethal, or they could actually make our vaccines less responsive. So all of this, those are the things we talk about every single day to try and encourage vaccination and adhere to at least basic public health mitigation strategies to try and keep the transmission down, but get everybody vaccinated along the way. Next slide. In Pima County, you look at our vaccination rates, we've done very, very well. We're especially proud of our seniors, which is the highest risk group at 95%, virtually all of them being vaccinated. And now we've added on the ages 5 and above because of the recent approval of vaccines for children at 5 to 11, and we're at already almost 85%. So that's pretty good. But if you look at in aggregate, the overall, as I said, 71%. So we're about a third of folks still not fully vaccinated. Next slide. So again, I want to remind everybody the steps to protect yourself and others. Please consider getting vaccinated. It's probably the best tool we have in our toolbox now to prevent the transmission of disease. And if you get the disease, keeps you out of the hospital, keeps you off a ventilator, and prevents death. Test regularly. If you know you're positive, stay home. Even if you're feeling sick and you don't know for sure if you have COVID or the flu, stay home. Get a test as soon as you can, and then take the appropriate precautions. And when you're inside and you're around people that you don't know, again, because of the relatively high transmission rates, it is a good idea to continue to wear your mask. The president is following this every single day. We have discussions. When can we let up? When will it be advisable? What are the metrics we're looking at? So we understand that people are COVID exhausted. They just want to put this behind them. They just don't want to deal with it anymore. But when we look at the good science, it's telling us hang in there a little longer. And we're trying to balance that against a population which wants to just desperately get on with life and not be, encumbered with all of these restrictions. So we understand the burden on society. We understand the pain that you're all suffering. We and our families are going through this as well. But hang in there with us a little longer. I think we'll be able to come out of this soon. The president will be working with ABOR and other presidents in the university system throughout the state to figure out our best path forward and how quickly we can move to a point where we can relieve us of some of these mitigation strategies that we're using, including masking. Next slide. So the COVID questions, this is important. They still come up. I get numerous emails, texts, and calls every day. Please use the Ambassador Team hotline. That's why it's there. You can email, you can phone. It's 7 days a week from 7 to 7. Any question that you have about COVID, vaccine, mitigation strategies, scheduling, places to get vaccines, testing, call the Ambassador line. They have all the information for you. Next slide. So I think that does, Bobby, and I'm cautiously optimistic. We're heading in the right direction, but as you pointed out to all of us and your discussions with ABOR and the rest of the university system, we've got to hang on just a little bit longer, and then we all want to remove all of these encumbrances which are protecting us because we're just so exhausted from this after 2 years.
Yeah, I would agree. We're hearing that CDC may make some proclamation in the next week or so. And I think the discussion we've had amongst the presidents and ABOR is to hang on and let's see where we are around spring break, which is in the next week or two. So, my hope is we'll be able to relax some of the things that we're doing. But for right now, we think it's better to stick with what we're doing. It's working. The case numbers are coming down. So, if we can get to a prolonged period of low case numbers and the R0 value being low, then maybe we can make some changes. The other thing, Rich, is I haven't been on our afternoon call last week. I think I only made it briefly one time. But what are you hearing from the international community about any new variants? I haven't heard much of anything. Yeah,
well, first and foremost, Bobby, as you know, variants arise all the time. It's just that they're not clinically significant. So the scientists who are tracking it through what's called sequencing, that's looking at the genetic makeup. We do that here in the state to be able to track because you want to pick these variants up. But often the variants may start someplace else around the world. So there are ones that are popping up, the B2, the most recent one. The real issue when you have a variant is to be able to say, is it clinically significant or is this just something that it changed? And by clinically significant, that it gives it new characteristics. The virus becomes more transmissible. It becomes more lethal. It develops an ability to resist a vaccine, for instance, or antiviral medications. So right now, we're not seeing anything that's worrisome, which is even more important, why we should accelerate vaccination to get out of this as quickly as we can. Because the longer we have lots of people that aren't vaccinated, that virus has a place to go and be able to mutate and come up with new variants. And as you and I have spoken before, I use polio all the time as the example when we were kids. Moms couldn't get their kids vaccinated fast enough because they were worried about the iron lungs and such. And now we hardly see cases in the whole world with polio. And if it does emerge, it's usually in an emerging nation that doesn't have a public health infrastructure. But in the United States, we don't see polio anymore because every child gets vaccinated. And it's a perfect example to remind people of the importance of vaccination, which I often say arguably may be the most significant advance in health science in the history of mankind, vaccination.
Yeah, I would agree with that. Even as I'm torn to say that the introduction of the heart-lung machine made heart surgery possible, vaccinations certainly had a bigger impact worldwide. Any idea about, we give the rate of vaccination in our state at about 70%. Any idea about, and I think it's probably closer to 50% nationwide, but what about internationally, globally, what's the rate?
It really varies. I mean, if you look at some of the European countries, they're up at 80, 90%. You see others that are less. Some of them, it's because they're emerging nations and they don't have the resources. Hence, we've had this discussion before. the importance of developed nations like the United States and our allies in NATO and so on to be able to share our vaccines with others. And to the average person, they go, why would you do that? Well, because if the rest of the world, we're 340 million people, and the rest of the world has 8 billion people, and if most of those people aren't vaccinated, that virus will continue to spread and mutate. So whether it's for humanitarian reasons or because it's smart science to get everybody in the world vaccinated, that's our best hope to get out of this as a global challenge. The pandemic is global. So it's not only about the U.S., it's about the whole world and getting everybody vaccinated.
Yeah, there's no question about that's the strategy. The sooner we get everyone in the globe vaccinated, then we, as you always say, we eliminate the potential space reservoir for these viruses to mutate in.
Right.
But one last point before we go to the questions, Holly, is we talked a lot about the really highly vulnerable population. And now let's just talk about here at home in Arizona. If you are a high-risk individual, then please stay away from as many people as possible. Wear a mask, get an N95 mask. If you're really highly vulnerable, especially if you're getting chemotherapy or radiation therapy or getting immunosuppressive drugs for autoimmune diseases or a transplant, you're gonna know that you're high risk. So please adhere to staying away from people, keeping as high grade a mask on at all times as you can. So I think that's where, as you've said all the time, Rich, where we can really make a difference here as we're running the end of this pandemic toward what's termed an endemic, where we'll probably have to just keep getting an annual booster for 5-10 years from now. I have no idea how long we'll have to keep doing it.
Yeah, as you know, Bobby, our colleagues at NIH and who fund a lot of this, and Tony Fauci's team, the research, are working on looking at this once it's endemic, just like any other virus, and making it part of the routine flu vaccine every year. Because, as you know, when we get a vaccine for flu, there's several different types of viruses represented there based on where they are in the world and transmissibility and lethality and all those things. So that would be the perfect solution to this. Just incorporate this in the future, and it's another virus we have to deal with. And as you said in the past, this is the way we're going to live in the future. It's what we're passing on to our children and our grandchildren, because these organisms will continue to try and thrive in our environment, and reaching some kind of a symbiotic relationship where we can coexist without one being disproportionately challenging to the others. But, Darwin told us, every living organism, every living cell is going to continue to evolve in order to try and survive in whatever environment they're in. And that's what we're up against now. We're seeing Darwin play out right in front of us now as it relates to evolution.
So for all those people who don't think that masks work, that distancing away from large numbers of people works, washing your hands works, vaccinations work. Just look at the number of garden variety flu cases. I think those are down. And probably because more people are getting flu shots, because we're talking about vaccinations every day. More people are wearing masks. More people are washing their hands more frequently, and more people are staying more distance. And that's proof is in the pudding there. So, Ollie, with that, let's go to the questions.
All right. Our first question comes from Craig Smith from Kagan. Go ahead, Craig.
Hi, given your concerns about spring break and the great judgment we historically see displayed at spring break, can you just amplify on your message of how folks can and should, not aggravate their risks in that environment?
Yeah, Craig, how do you get the pole position every time? First come, first serve. There's a sign-in list, and you're the first one in every time.
I just raise hand on entry. It's just tactical.
So think about it practically, Craig. What we would love to see people do is get tested before you go on spring break, because it'd be a bummer if you couldn't go where you had planned to go if you test positive. But think about how you're going to get there and how many people you're going to interact with, and you'll be a vector spreading COVID-19. And this is how it spreads. This is why we're worried about this stuff. So, the best course of action, in my opinion, would be get a test right before you go, and then get one when you come back. And when you're wherever you're going, try to do your best to stay away from as many people as possible and wear a mask. Now, having said all that, I'm sure that, there's not going to be a lot of masks. Where's the number one site? I always thought it would be like Cancun or Vegas or something for our area, but I still think that Florida is still a big site, even for people in Arizona to go for spring break. So, the good news is most of the stuff's outside, but as you said, the judgment on spring break, probably not going to be masking up too often, which is unfortunate, but test when you get back. And, I will be shocked if we don't see a bump in cases after spring break.
Mm-hmm.
Thank you.
You're welcome.
Greg's got the only question of the day today. So if anybody else has a question, you can raise your hand. If not, I think you guys are off the hook.
But usually if we wait here long enough, there's some question that comes along.
That's true. Do you have any closing remarks or anything you want to share?
I don't know. Rich, you're so involved in things nationally, internationally, at the state level. Any final words of wisdom you've got?
Well, I'd say you brought up the CDC before. I think the CDC is struggling with the same issues that we're struggling here. The juxtaposition of the science, which says we're not out of it yet, although better, and feeling the social anthropological burden of just burnout that, everybody wants to get on. And I anticipate that they're going to come up with something that is a hybrid, if you will, that, recommending masking, but deferring to local communities based on transmission to be careful, make sure that the at-risk people are, as you pointed out, Bobby, are sequestered appropriately and wearing masks and not exposing themselves. So I think it's going to be something like that. The last thing will be, the after-action report. What have we learned in the last 2 years that will help us be better prepared, not only for pandemics, but any and all hazards we may face as a nation? Earthquakes, hurricanes, terrorist events, all fall under all hazards. And we need this robust program. Now, we have it. We have a national response framework. Wasn't used as well as it could have been. And each state has struggled to where I've kind of looked at this as the disunited states rather than the United States. Messaging has been a problem, confusing the public. So I think the optimism in me says we've learned a lot the last couple of years. Now, shame on us if we can't make a better system as we move forward based on all of these experience so that it'll benefit the entire nation and hopefully realize the burden of having allowed a virus to divide us politically when we should have come together as Americans to fight this as one group, period.
Yeah, I think, Rich, it sounds like two old guys just sitting around talking, right? But
two old surgeons.
Two old surgeons. But let me tell you, if you've ever seen anyone in an iron lung, if COVID had put people in iron lungs, I think we would have had a different take on this thing. Yeah. And it's been unfortunate, but I hope you're right that we will collectively learn from this and be prepared. And so, it's been 100 years since a major respiratory. Remember, polio wasn't a respiratorily transmitted virus. It was a fecal oral pattern from water. And so that was a little bit different. But I hope, the big ones are going to be these respiratory transmitted viruses.
Yes.
Going to be the big killers.
Yes. Bobby, you mentioned the first pandemic in like a little over 100 years. Now, what is interesting, I've said it before, if you read the history of that pandemic, John Barry probably had the best book out, but there's a lot have been written. If you change the dates, it's almost exactly what we've gone through. Yep. Fighting about masks, fighting about, all types of mitigation strategies. Of course, vaccination wasn't readily available then. It was different, but yet the polarization of this was so vast. The economy issues, getting back to work, staying home, wearing a mask, not wearing a mask. And yet 100 years later, we went through the same process.
Yeah.
So, history is the prologue to our future. We need to do a better job of memorializing these experiences and providing it as part of education to all of our students, for instance, who are going to go forward so they don't have to reinvent the wheel the next time we have some big challenge like this.
I think it's interesting. Craig just put into the chat that HIPAA has really prevented the media from showing the full impact of what COVID has had nationwide, and it's allowed skeptics to claim it's less than it is. What are your thoughts on that?
And I think as we get together, and I know that President Robbins will certainly be strongly in favor of this, to have these kind of community forums when things are better and say, what have we learned? To bring the media in and say, what can you tell us that we can do better, okay, to inform you, because you are our network for communication, and bring in the docs, the nurses, the paramedics, EMTs, and come to some conclusions in each domain that is necessary to keep us healthy and safe and secure, and then make that, that everybody agrees, here's how we're going to act as we move forward. We have a national response framework, but we really didn't adhere to it as we should, and we became divided for other reasons. Let's do it better next time, and let us be the great nation we are, and not be divided by a common foe.
Yeah, I think there'll probably be some sort of, there'll probably be many of these white papers written, but how the Institute of Medicine always gets together to tackle big problems. And I think there'll be, an analysis of what we could do better in the future, because there's another one coming. It could be swine flu, it could be something else, but the big ones are going to be these respiratorily transmitted viruses that I'm really hoping that we do learn something from this, but there's going to be a recalcitrant part of the population that's just not going to go along.
Well, it's the perils of democracy, the right of the individual versus the collective right of society on all of these challenging issues. And usually the collective right prevails. And it really means in a democracy we have to compromise. And it may mean you do something that you don't want to do, but it's not hurting you and it's for the benefit of society. That's how we prosper as a society. We give up. Everybody, look at smoking. I always use as an example from when I was Surgeon General. People would tell me, I'm an American. You can't tell me not to smoke. But your decision is causing catastrophic consequences to people around you and the cost of care. And we, the people, have to pay for your cancer, your lung disease, and so on later in life. And again, there's no right or wrong answer, but these are tough policy issues that we have to put out in front and discuss. And I think, Bobby, no place better than universities where we have the freedom of that kind of speech to get into these discussions. And like you said, Institute of Medicine, our friends, Victor Zal there, who's a great thought leader, to be able to pull us all together and become a better, more perfect union, which we're struggling right now. Well,
it's sort of hopefully at the tail end of this. Now, of course, we had Delta and Omicron, and, I keep saying that Zeta or something else is going to pop up. But look at what's playing out in Canada. Who usually have a society or a culture where they kind of go along and do, what the government and what they think is right for society. But you're seeing a big pushback.
Right.
And then when they try to crack down on this pushback, you get claims of authoritarianism, and so you're right. These are very difficult and complex policy decisions. But wow.
Well, I think, Bobby, I always think of Winston Churchill's remarks, which I'll just paraphrase, which essentially he said, democracy sucks except for everything else.
Yeah.
Okay. And this is our democracy to keep. And if we don't, then the challenges as we move forward are limited because you get into some type of authoritarian or dictatorship type of a situation, and nobody wants that. We have to start appreciating the great value of what we've created in this 250-year experiment of democracy, which includes all of the lessons over the last couple of years to make this a more perfect union.
And that includes development of vaccines and the heart-lung machine and lots of other drugs and things. Holly, any other questions?
No other questions, but I do want to, before we sign off, just remind everybody that we will not have a briefing on March 7th, a week after this, because that is the first day of spring break. So I think we'll be back on the following week, March 14th, but we will have a media release to let everybody know when exactly we are coming back.
All right, as always, as we're headed toward spring, it's beautiful weather here in Tucson. So that's one of we're blessed to live here. And so as the weather gets better, just continue to practice all the things we've talked about. Wash your hands, stay as far away from people as possible. If you've not already, and if you haven't been boosted, vax up. And as always, mask up, bear down. We'll see you next time.
Go Cats.
Hello, good morning, and welcome to this webinar today. My name is Peter Hertwig. I am a head of unit in the European Commission's Directorate General for Research and Innovation. Today's webinar is dedicated to coordinators and beneficiaries, or better to say to future coordinators and beneficiaries of grants in Horizon Europe. So you are a group of very successful people today because you have passed a fierce competition and you were successful. Your proposals were evaluated and you are now about to enter a next phase. We will enter in contact with you and you will start preparing your grant agreement. And today's webinar is dedicated to the technical details and all the obligations that yet have to be fulfilled in order for us to sign your grant agreement so that then you can start implementing your projects and, of course, charging also the costs related to the projects. We have published an agenda, so we will start with an overview of the whole process of grant agreement preparation, and we shorten it always saying it's the GAP process. Then we will have a presentation from our validation service related to the obligations for registering and validating the legal entities. Before we can sign a grant with you, we need to know that your organization is actually a legal entity and what kind of categories it belongs to. This also will cover something that is called the financial capacity check, but we will talk about the details later. We will hopefully have a short coffee break, and then we spend a few moments on the so-called description of the action. That means the technical annex to the grant agreement that you will have to prepare based on the scientific technical content of your proposal. And finally, we will spend a while on the legal and financial aspects related to the signature of your grant, but also later on to the running of your grant agreement. This is a hybrid meeting, meaning that also on our side, some people are present here in our new studio, and some of the presenters do this from home. For us, it's also the first time we do this, so please bear with us if there is the one or the other little technical issue in between, but we keep fingers crossed that everything goes very well. This meeting is live streamed, so we expect many participants so that it's not possible that people can actively be involved and ask questions orally. But we have, of course, a back channel for reactions from the audience and for asking questions, which is Slido. So when you follow the meeting, please open in parallel the Slido and go and use the hash that is hopefully presented in a moment on your screens. If not, I will also read it out to you. So it's COO-DAY GAP. It's the abbreviation for Coordinators Day on Grant Agreement Preparation. And then you can start already now, immediately, as soon as you have a question, putting in your questions, and we will then have a short interruption after each section and reply to a maximum of your questions. If you see that your question or a very similar question is already there, please don't put it a second time, but simply like the question that is already there, and then we will go through all the questions in the sequence of number of likes so that we start with the most popular questions and provide our replies like this. And I think, yeah, one more last comment. This whole session is recorded. So that means for colleagues that cannot be present today here, there is always the possibility to watch this afterwards on our YouTube channel. And with this, I think I can stop my introduction and I hand over the floor to my colleague Petros Belsis, who will start with the first presentation on the overview of the grant agreement process. Please, Petros.
Hello and welcome. We will go through the process of the grant agreement preparation. We will have a presentation on the main aspects and then also a little hint on the technical things, how you can do the things that we will present. Can we start? Okay, thank you. So the grant agreement is the outline of my presentation. We will start with an overview. I will show you how the processes are working. We will introduce the need for roles and access management setting in the system. We will show you in brief the new elements that are required for you to do in comparison to what we had in Horizon 2020. So there are some changes and then we will briefly discuss. And a small, let's say, guiding through the technical aspects and the tool. Here you can see the overview of the grant management life cycle. The grant agreement is a small part, but not, let's say, it's equally important. So you can see starting from the publication of the call and then your preparation of the proposal that you have already seen this part of the process. Then once you receive the letter with the evaluation and the comments from the experts, you start the grant agreement preparation. And through this presentation, we will show you the main things that you have to do. It is a well-defined process. It has a timeline that we will explain in short in the next slides. It has some requirements that you must be aware in order to respect all the things and to prepare all the data so that you can submit, and then the grant, when it's signed, you can start with the actual work for implementing what you have described also in the proposal. So in the main principles, we have established a single gateway for all the exchanges during the lifetime of the project, and that is the funding and tenders portal that you are already aware. So you have seen already the preparation of your proposal that goes again through the portal. You may have encountered also the part that you register your organization and you set up the main attributes that are related to your organization. In brief, we have a deep integration of all the IT tools and services. So you start from the portal, and no matter if you want to set up something for your organization, you want to submit a new proposal, you want to manage your project, later the reporting when you go ahead, everything goes through the portal, and all the tools that may be behind, they are integrated, and you have a uniform experience. We have common business processes, which are essential, and then everything that is related to your project, starting from the definition of your project and the rules, that principle, and defining also the preparation of the grant agreement or the reporting. You will see that all the common rules that are there for the program, they have been implemented through business processes that and IT support behind it. In general, everything is electronically signed. So the documents that you sign, at some point they are sealed. They cannot be altered anymore. I mean, if you need to do something to change something for your project, you need to create what we call an amendment. So you need again to start and defining, and then the documents are finalized, and they enter into force and they are binding for both you and for us. We have established digital signatures on all the formal documents, so there's no more need to have blue ink signatures, so we just sign electronically. That's why it is very essential to know that we do not allow to share the accounts, because everything that goes with your account means that you can sign and you are legally bound. So it is not suggested that you share the accounts, but when needed, you can create multiple, let's say, accounts and assign different accounts for different persons, and you can assign the same role to them if they are acting with the same privileges. We have a single common document repository, which means that for all the lifetime and for years after, as long as you have access, you can always have access to these documents that are related to your project. Through the process that we have defined in the system, we always trace the actions. So we can always see who and when something happened, an action that is related to important, let's say, legally also bound actions in the project. So everything is audit trailed, and we can later trace it back and find when and who did what in the system. The business rules, of course, they are implemented in the IT tools, and we always are there to ensure compliance with the definitions and whatever is defined in the program guide and the legislation of Horizon Europe. So the acronym, you will encounter it. So by GAP, we mean the grant agreement preparation. So this is an acronym that sometimes will be used throughout the presentation. It is the process preparing the signature of the grant agreement. It is a well-defined process, and it has it is time-bound, so we have very specific time frames that we need to respect. That is a requirement that comes from the financial regulation. So the financial regulation defines that from the time that the call has closed until the signature of the grant agreements for the proposals that have been successful, the time frame needs to be 8 months in maximum. But as you understand, in the meantime, there is a very complex and difficult process, because we need to go through all the proposals that were submitted, to evaluate them, to define the experts that will review them, to have later the outcome and create the list of projects that are successful to be funded. So usually for the evaluation of the proposals and the reviewing them, we need at least 5 months. It is also a very challenging deadline, but in general we respect it, which means that you have 3 months left to prepare your grant agreement. The definition of what is needed to do in the grant agreement preparation, it is very specific, so it is enough time for you, of course, with considering that you will be also reacting on your side when it is needed. Then, after you have signed the grant agreement, you can accede to the grant agreement by signing the accession forms for each beneficiary, and you can receive the pre-financing and start the actual project implementation. So what we would suggest because there are specific deadlines, as we mentioned, so you need to align yourself with the deadlines that you will also be informed when you receive the email for with the results of the evaluation. So you need to respect the deadlines. There are some exceptions only for projects that are from the ERC, the European Research Council. But in that case, always, you don't need to worry. It will be mentioned in the email that you will receive. So you need, in cases, because sometimes unforeseen things happen, you need to be always alerted and to notify the counterpart, which is in your case the project officer always. So in case something happens unforeseen, you need to inform your project officer, and if necessary, of course, you need to propose an alternative plan, something to manage the risk if it has been, if it was unforeseen and you want to react. You need also to be aware that non-respecting the deadlines could lead the termination of the grant agreement, and then you will not receive the funding and your project will not be funded. In here you can see a little, let's say, more detailed overview of the timing. So from the moment you receive the invitation and the results of the evaluation from the reviewers, you need to have let's say, you need to consider 3 weeks in general to prepare the data in the system. In the meantime, as you will see, there will be several checks also on our side, and also you can also do changes, or you can, if you have questions, you can always contact the project officer. After this first introduction of the data, you can submit to the project officer, even if there are some, let's say, details missing or something, so that a review can start. Within a week, the project officer will reply. Maybe there will be an exchange of, usually it takes 1 or 2, maybe 3 for most of the cases, exchanges between the project officer and you, your side, the consortium, to clarify things and in order to submit the final data. As you see, we leave a specific time frame. You need to also to allow to have at least 1 month, let's say, in general, from the time frame that we discussed, the maximum of 3 months, because there are in many cases issues that will be identified by the experts in cases of ethics. For example, if you are doing research on human cells or something that is bound by the ethics legislation. In that case, if it is your project, let's say, having to do with specific medical or other related data subject to ethic review, it might need to consult the member states, and that takes at least a month. So please, the faster you can be reactive, maybe in most of the cases you will not be considered for that, but in general we say that the faster you react, the better for everyone to respect the deadlines. Here you can see an overview of the different steps that are part of the grant agreement. So once you receive the invitation, we start the grant agreement preparation. Then the next step is to start, this is also in parallel going with your actions. So for the participants, the beneficiaries that have not been yet validated by the validation services, this process is also automatically triggered. So your legal representatives need to be appointed and other documentation needs to be provided so that you can be validated in order to be able to be funded. Also, the legal representative needs to define some roles. We will have a detailed explanation later. So you need to set in the system roles that to assign the persons who will be able to sign for you the financial declarations when needed, or the signature of the declaration of honor and later of the accession form for the beneficiaries. And of course, for the coordinator, the person who will sign, who will submit the data and will sign as a representative of the consortium the grant agreement. Then, of course, while preparing the data, this is a well-defined process. Again, you need the data that you need to provide are some for policy reasons that, and many of them you have already started to prepare in the proposal. But here the change is that we have some tables, so they become more structured. The process is more detailed, and the data are more, let's say, fine-grained, so you need to fill some tables instead of providing us with some text. But in general, if you move parts from the proposal to the tables and you remove also from the non-structured parts from the text the data so that you don't replicate them, this is all that you are asked to do. As we said, then the next step is that you can already request from the project officer to review the grant data. There could be iterations in case some data are not full completed or they are missing something or you need to correct. In our side, they are also in parallel, we're running some ex-ante controls, some checks, also especially, for example, as an example, we could give that we check the financial viability of, for example, of the coordinator, who's a very important role in order to receive the funds and later disseminate to the beneficiaries. We make sure that we have reserved the funds and we prepare the award decision. So once everything is completed, the coordinator is the first one to initiate the grant agreement signature. So you will sign electronically, as we said, the grant agreement. Then the commission countersigns, and then all the beneficiaries need to sign the accession forms. And of course, you enter into the pre-financing, and then your project has already started. The main principle, we have the non-negotiation approach. So your proposal is taken as is. You don't need to change anything. We have a very competitive reviewing of the proposals. So the proposals are evaluated based on the merit and not on their potential. So the grant agreement also is prepared on the basis of the proposal which was selected for funding. Sometimes, of course, you receive comments from the experts what you could improve, but we do not require that you necessarily do changes. You are free to improve, let's say, areas that the experts suggested, but this is not necessary. But there are other changes that will be necessary, of course. So there are changes that are required to meet legal and financial requirements. For example, there could be a change in the status of an organization which could impact the funding rates. There are other requirements that are obligatory to change. So if the experts had identified that your project is subject to ethics or in specific areas of security that you need also to, maybe in that case, you will also have automatically you will find automatically that a deliverable has been added for you for ethics and security if applicable. There could be changes due to the removal of participants. For example, if a participant cannot or there is something else that prohibits them from participating in the project. But that is a more, let's say, delicate case because, as you understand, removing a participant can impact very much the potential of the consortium to implement the project, so it has to be agreed. Of course, in that case, you need to consult with your project officer who will approve the change, or if there is something else, they will notify you. Of course, there are some kinds of obvious inconsistencies or some clerical errors, so there could be typos that you could correct. And we need also to emphasize that saying no negotiation does not mean that there is no control. So on our side, we are doing also eligibility and viability, for example, financial viability checks. Or there are also anti-fraud measures on our side and risk-based controls which are carried out in order to ensure that everyone and everything can go as long as we know, to the extent that we know that it can go fine. You need to be also very aware that non-compliance or serious breach or negligence for applicable rules can lead to termination of the grant preparation. And of course, in that case, if you have not, you always need to be transparent and to be, let's say, respecting the rules. Otherwise, it can, in very few cases, of course, can lead to termination of the grant preparation. What is the minimum configuration and what you have to do at least in order to be able to sign your grant agreement efficiently and correctly? So the minimum requirements is that every organization needs to have what we call the LEAR, the legal representative, which will be assigned during the validation process. You will define, and then you will provide documentation from your organization. You need, we always need to have the primary coordinator contact, it's the person usually who has submitted the proposal, so it's the person who will act for most of the actions on behalf of the coordinator. And then you need to have one participant contact per beneficiary. And the LEAR can appoint one legal signatory, one person who will sign the legal documents, and one person who will sign the financial documents for each organization. Of course, these are roles, so it could be the case that you could have one person assuming all these roles. For example, the LEAR can assign, you can sign legally or financial declarations. So as we said, we had defined everything is electronically signed. There is this kind of what we call chain of trust, so you can manage the roles, and you can also have multiple persons having the same role. What we need only to make clear is that a legal signatory for an organization means it's a person who can sign legally documents for any project. In your project, you need to define also which of these persons having that role will sign for you. So we have what we call the project legal signatory. So it's an extra action that you need to define within your project to say that from the available legal signatories, if there are more than one, this person will act for our project. Here you can see a little an overview, a diagram that shows how it works. So the grant agreement with the Commission starts when you are when you are informed about the grant agreement. You enter the data in the system, then the coordinator and the beneficiaries sign the declaration of honor. When the grant agreement is ready, the project legal signatory for the coordinator signs the grant agreement, the Commission countersigns, and then the project legal signatories for the beneficiaries need to sign the accession forms. We will just show you something that is new, required for Horizon Europe projects. It's a task that impacts the LEAR, but it's not to be performed directly. I mean, it's not a part of the grant agreement per se, so it's not somebody who's working on the project who will do this. It's a task by the LEAR, but it's very important because it can block you later during the grant agreement preparation. So, as you know, there are some requirements in every program, and in this case, in Horizon Europe, a new requirement is related to what we call having a gender equality plan. This is a requirement that maybe for you, for many of you, which are already now in the grant agreement, which means that your call was already evaluated and closed within 2020, does not apply yet. But it will be obligatory for all projects that will enter the grant agreement, and their call will have a closure date within 2022. But it is essential also to know, so you need to notify your LEAR that, and you know also that your organization, for specific types of organizations, if you are a public body, a research organization, or a higher education institution in the member states or the countries they associated which participate in the project, then it is a requirement in order to be able to participate in Horizon Europe to have a gender equality plan. So you need this is a task that needs to be performed by your legal representative. It's not by you, but you need already to warn them, because maybe if you don't have it, you will be later blocked during the grant agreement preparation. What you have to do in order, or your LEAR has to do, so you need to enter again in the portal you see here with the numbering, we have the number 1. You enter in My Organizations on the left side. Then you select your organization, and from the actions, you enter to modify the organization. Then, from the different tabs that you have different selections for data, you need to select to modify your legal information. And by editing this legal data, there is an option on the bottom of the page that says change the acronym for the Gender Equality Plan. The requirement to define the Gender Equality Plan is, of course, you have just to answer if you have or not. But it's not only that. We need to ensure that it fills a minimum set of criteria. You need to have at least the 4 fundamental parts, the main blocks, what we call, that a gender equality plan needs to fulfill. If one of these is not set to yes, then of course, again, the yes-no question will turn automatically to no. So you need always to ensure that you fulfill these criteria. Please read all the information and answer carefully. And of course, you need also to, you know that the requirement, as you will see also, is to have it somewhere as a public document. So later, failure to provide the gender equality plan if you are, if it is requested, it will result in exclusion from the list of successful applicants. Or if you already have started the grant agreement, it may terminate the grant agreement. The second thing that you need to be aware is a new organizational status also that is linked to what we call international European research organizations. If it concerns mainly to define if your organization is an international organization, and if it is, of course, you will be needed to provide additional documentation. But in that case, you also have to show if you are international European research organization. If your organization has already declared in the legal data that you are not international organization, then you don't need to do anything. But in cases that you have not defined if you are an international organization, you need to do so. You just need to say no if you are not. And then you need also, in cases when you are international organization, you need to show if you are this International European Research Organization, or shortly IERO. There is a flag there, you just need to set it. The only issue for you is that if you haven't set anything, you have not replied if you are or not international organization, then we cannot know. And it is important in many parts of the Horizon Europe. It has implications in the eligibility or in the funding. So you will, in that case, be blocked. But if you have defined already that, as I said, you are not an international organization, then no further action is required from you. This is again how you can do it. Edit, again, you enter the legal information in the organization data, and then you edit and you define yes, no to the respective questions. Of course, there is, in case you want to know the definition, as it is shown here in the slide, you can enter this informative button, and then you can see if it is applicable or not for you. In brief, some technical aspects of the how you can also do some basic things, a very short walkthrough. We also have later together, we have another very interesting for you presentation for the description of action, where we also go a little more into some technical details. But just a brief overview. So in that case, you see again in the left page, you have always, you manage everything. So if you want to manage your organization, your proposal, your project, in that case, you go to manage the project that you have. And here you can see a little, we will just walk through the different menus to see. So you see on the upper part, we always have what we call this, the metro line. You see that some are already colored, some are not yet. The different colors have to do with the state that we are. So we are almost in the middle. And then you have the next steps, for example, that are with the gray color to be performed. On the left side of here, you see that you have the basic data for your project. so the duration, the type of action, the acronym of your project. Then you can always access the latest legal data related, of course, to the project and your organization. We have the processes that are active for a project. For example, in our case, we only have still the grant agreement preparation. Once it is signed, you will see this will not be active anymore, but you will have also new actions that will enable you to manage your project later reporting. This is the document library, so all the documents related to the project can always be accessed from here. The communication center where you can launch interactions with the respective services, be it your project officer or the help desk, and archived processes which have been already completed. So here you will see the declaration that you have to sign and the grant agreement preparation, you enter it by here. For example, this is a button available only to the coordinator. Once everything is ready, you will be, the coordinator will be able to submit. And always on the last side, you have here online manual, which is a collection, let's say, of online help that explains you for the business process and how to do it, and a detailed how to for all the process, not only for, of course, the grant agreement. So once you, I will just show you again back here. So once you enter in the grant agreement and you want to change something, you enter, it is transparent for you, it is another tool, but it is uniform, the experience. So you enter in another, in the grant management tool where you will see the different tabs that you have to fill. And this will be presented in the second presentation that we have today in detail. You need, of course, to enter. Some of them will be only for information, so you don't need to enter anything. Others, they will require from you some data to fill and complete. Here is the legend, so you can always have there a sign on the top. This means that there is something that is blocking you, and you cannot later proceed or submit. And then, of course, sometimes you will see this information, which means something is missing. It's not blocking, but it could become. So always you need to be aware and to correct these errors. So what we would just summarize what needs to be taken into account for attention. You need to avoid repetition. So when you enter in the structured part into the tables, you enter the data, they don't need to be repeated, because you also need to upload the document with the description of the action that, of course, we will present in the next presentation later today. When you have requirements coming from security and ethics, then you always need to know that they are binding, and in some cases, you will need to also ask the national authorities for their certificates to be submitted, and in cases also if your project is concerned for security scrutiny. And takeaway messages, please pay attention to the deadlines. So be always proactive. If something happens, inform your project officer. They are there to help you. Be transparent if you face difficulties. So please notify us and try also to come up with a plan. And of course, collaborate with us and the project officer who is your counterpart. We are always there to help you. So thank you. And I think with that, we have completed the presentation. Maybe we can go to the questions, if there are any in Slido.
Thank you very much, Petros. I hope I am on air again. Colleagues, can you give me a sign? Yes. So Petros, please join me here. And we indeed have now at least 10 minutes for replying to the questions that came in from Slido. So can the colleagues in the technicians room please bring up the first Slido questions? Thank you very much.
When is the approximate deadline for signing the association agreement if UK partners want to be full partners and receive a grant? I think...
okay, I can reply to this one. So for the moment, the United Kingdom is not an associated country, which means that the United Kingdom participates in the projects and in Horizon Europe as a third country not automatically eligible for funding, which basically means that the only possibility to participate is as so-called associated partner. It is currently also not foreseeable when the association could take place. So that means for the grant agreements currently already in the state of grant agreement preparation and to be signed soon, there is only the possibility for the UK to participate as associated partner. Can you bring up these questions again? So
the researcher tab, it would be great in the future to foresee the possibility for the coordinator to access or edit and check the section for all beneficiaries. Actually, this is due to data protection issues. That's why we have not, let's say, we allow the respective beneficiary to edit their researches. So this is the reason why it is done for that. Maybe the next question. Why does the portal does not allow to appoint associated partners as work package leaders or deliverable responsible if there were no restriction on the call proposal? Yes, this is correct what you mentioned. Actually, you know, the concept of associated partners is new to Horizon Europe, and due to a technical issue, it is not yet available. We expect that it will be in the new release that will come in towards the end of February. In the meantime, I think if you are really forced to sign the grant agreement immediately, you may do the change later. So, but it will be allowed. Yes, we know that, and we're working to correct it. So, the pre-financing we were offered is much lower than in our experience on Horizon 2020. Is that a negotiation threat? What is usual?
So yes, Petros, maybe I step in here. So about the pre-financing. Of course, the pre-financing in principle, if we follow the financial regulation, is a matter of agreement in the individual case. We have general orientations for Horizon Europe that have not changed with regard to Horizon 2020. So we would have to go into the individual case to see what is happening there. But the general reply is yes, there are general guidelines and they are not different from Horizon 2020. Maybe to come back to the very first question and one precision on the participation of the UK. So UK today is in the list of the so-called to-be associated countries, together with a whole list of other countries for which the association negotiations are proceeding in a certain time frame. Okay, next question. Our validation report shows researcher errors, add nationality, etc. Do I have any way to find out which researchers are still missing so I can remind them? Petros, can you reply?
This should be obvious to the participant contact for the beneficiary. So you can ask, I mean, the person who is entering the data for the beneficiary should be able to see it. Normally, I don't know if this is a specific issue, but the beneficiary, I mean, it cannot be if the question is this. For example, the coordinator cannot see, as we said again, the errors, but you should check with the participant contact for this beneficiary. In any case, as you know, it is possible either to retrieve the data automatically from the portal or you can manually enter. So in any case, you can always enter manually the data that are missing for a specific beneficiary.
Okay, next question. If an association agreement is signed after the grant agreement, is it possible to change the status of associated partner to full partner with EC contribution? I think the reply is in principle yes, but. And the but relates to the maximum grant amount. So that would, in the first instance, require, of course, an amendment because it's a change in the consortium. And in the second instance, it would require a rearrangement of the budget in the whole consortium to find the contribution for that additional partner. We have no possibility to increase the maximum grant amount in this case.
And also, we do not know the budget that associated partners, when you are associated partner, you can enter a budget that you need to find with your own resources. This is not in our budget tables. So it's only in the description of the action. We do not enter into the system. So indeed, you will have to maybe reshuffle the budget, but between your beneficiaries, which means that maybe you need also to diminuate the amount for others if you really want to do that.
Next question, how and when will the gender equality plan be checked for organizations that already are validated? So in the first instance, maybe we should repeat that for all the calls for which you are now in grant agreement preparation, meaning that had deadlines in 2021, this is not yet an obligation. So this is not yet an eligibility criterion. It will become an eligibility criterion for all the calls with deadlines as of 1st of January this year. But then, of course, the question remains, how will we check? And we pursue here in the first instance a trust-based approach, which means the legal entity appointed representative of the organization has to reply a series of questions on the content of their gender equality plan and on the existence, of course. And we, in the first instance, trust the reply by the leader to these questions. But this trust-based approach will be accompanied by a checking, reviewing possibility based on sampling. So we will do random sampling or sampling based on risk considerations. And then we will have deep checks on the organizations that are hit by the sampling, so to say. Next question, do partners need to fill in the information in the tables with the researcher information themselves? If yes, how? We can only access and edit coordinator info. Petros, can you reply?
Yes, there is a tab that Ieic project. No, wait, do partners need to fill? There is a tab that is called researchers, and it is available for every different beneficiary. So you need to enter the values for your organizations. If you are the coordinator, you can only enter the researcher for the coordinator. But we have later in the description of action, we have a detailed, let's say, screenshot. We will show you how to do it. So maybe you will get the answer visually also there in the next presentation a little later today. A number of Ieic projects are audited right now in LIBO following Horizon Europe rules. When will the Horizon Europe indicative audit program be published? And this is very specific, I think, to the EIT.
So yes, maybe to reply to the EIT kick question, the indicative audit program is under preparation and will be published possibly towards the end of the year, because the Horizon Europe audits will start only next year. On this particular question on the EIT, we cannot give very detailed replies here because none of us here is the experts. So we see who asked the question, fortunately, and we will come back to the person directly. We still have 2-3 minutes to go through more questions. Okay, where can we find an additional explanation about using average personnel cost as unit cost? Can we just choose this as an option without approval from the Commission? I would suggest we postpone this question to the last presentation and the round of questions, because we will have a presentation on legal and financial issues where it might even be touched already in the presentation. Next one, if the UK has to be an associated partner, can their lead work package, lead tasks be responsible for deliverables? A reply to all questions, yes, with the caveat that we said that we have a technical issue for the moment to insert in our system associated partners as work package leaders, but this will be solved very soon and then it's possible. When do we have to submit the CFS? Also, this question I would suggest we postpone to the last presentation. It may already be covered by the presentation. Next one, third countries participation. A plan for the protection and enforcement of IPR is requested. What extension is recommended for that plan? Is there a template? Petros?
I think there is no template. You just need to explain. There will be, this is an issue that you will need to explain later during the reporting periods. There will be also questions specific related to how IPR is in the interest of the European, let's say, Union in case of exploitation in third countries. But we have in the reporting template, and so far there is no foreseen, not in the reporting template, in the reporting system you will find specific questions to be answered. It is not foreseen yet to provide something like a specific document, but that you will get in contact with your project officer.
Okay, and maybe the last question, because we have to move on in our agenda. What is the expected timeline for projects awarded under the Ieic Accelerator? This is again a specific question to which we do not have an answer here. We might go back in the background and contact the Ieic colleagues and come back with an answer later. And I'm afraid we cannot go through all the other questions. They are not lost. We will download them all from Slido, and we look through them and maybe build on this basis new FAQs if they are of general interest. So thank you very much so far for your interest and your interesting questions. I would maybe also ask you, many of you did it already, indicate who you are when you ask questions. It is not an obligation. You can of course stay anonymous if you want so, but it will help us also in following up the questions afterwards. And maybe even also add to your name the organizations you come from. That would be very helpful for us. Many thanks. And I think we have now to move on in our schedule, and we come to the next presentation that will be given by two colleagues from our legal entity validation service. So I would welcome Alina Ungureanu and Alberto Romero, and they will tell you everything you need to know if your organization is not yet legally validated, and in case you have to provide data and documents for financial capacity check. So please, colleagues, take the floor and start your presentation.
Hello, morning everyone.
Yes, we can hear you.
My name is Alina Ungureanu, and I work in the Central Validation Service, and together with my colleague Alberto Romero Quisios, we will take you today through the legal validation and financial capacity assessment. This is the outline of our presentation. We will say a couple of words about the Central Validation Service. Then we will discuss your registration in the participant register. Afterwards, I will take you through the legal validation process. And we will also discuss about the appointment of the legal entity appointed representative, what we call the LEAR. And this concept has already been introduced to you by my former speaker. Afterwards, my colleague Alberto will present to you the financial capacity assessment, and then we will finalize our presentation by actually giving you some hyperlinks to guidance documents that you can consult. Well, let's see in a nutshell what the Central Validation Service does. We verify the legal existence and legal status of entities. We validate the LEAR. At the same time, we validate legal changes of validated entities requested by the legal entity appointed representatives. We prepare financial capacity assessment for the responsible authorizing officers. We also perform third country control analysis. We perform ex post status verifications. We assess universal takeovers of validated entities. And we create legal entities and bank account files in cooperation with DigiBudge. This is, once again, an overview of our main tasks. And during today's presentation, I will take you through some of these main responsibilities already presented in this slide. Here, we have set for you the overview of the validation process. And this is a slide that will appear in our presentation a couple of good times every time we begin the presentation of a specific section. And you can see here that we will take you through the registration phase, the verification and validation of legal data, through the LEAR appointment, and through the financial capacity assessment. And we will start with the registration of your organization in the participant register. So this is how the participant register looks on your side, on the participant side. And some of you might already be familiar with this. You can choose your preferred language in the CEDIA participant register. However, for legal reference, the English version will prevail. And here you have the option to actually search for a PIC if your organization is already registered, or to register a new registration. And these are the steps that you will have to go through in order to register your organization. First of all, there is a step called identification or duplicate check. And here you can introduce your legal name or the VAT number so that you can identify if your organization is already registered. If not, you can move on with your registration and you can introduce your organization data, which means the legal name and then the legal address. And then the third step refers to the legal information of your organization, of your entity. And here you can introduce the legal status and the legal form of your specific entity. And the fourth step refers to authorized users, and I'll spend a couple of moments here because this is the moment during your registration when you actually have to introduce the name and the email address of the self-registrant and the backup. And here the system actually gives you a warning that it is highly recommended to add an authorized user to access your organization for backup function. So please keep in mind that you can add a self-registrant and you can also add other persons as backup, because the self-registrant is actually our contact point, so the Central Validation Service contact point before and throughout the validation process. So on your side, we need someone who's actually replying to our messages, replying to our questions of clarification, and who's actually uploading, submitting the requested documents into the participant register. And once your registration is completed, you get what we call a new participant identification code. So this is the PIC number, which is a 9-digit unique registration number, and this PIC is in a declared status. Please remember, declared means non-valid. And this was the overview of the registration phase. And now let's move on to the second section of the validation process overview, which is the verification and validation of the legal data. 3 main points here. Registration data is verified by the REA Central Validation Service before the signature of the grant agreement or a contract. The legal validation of a participant in the single electronic data interchange area, which is CEDIA, is done once when the entity has to sign its first grant agreement or contract. And finally, validation is reused for future participations in EU grant and procurement actions. Again, very important, validation is performed on the basis of supporting documents submitted by you, by the participants. And the validation is performed in accordance with the rules on legal validation, LEAR appointment, and financial capacity assessment. And here we have actually introduced a hyperlink for you, and we also introduced the link in our final slide with the links to very useful documents that you can consult on your own. And we actually recommend to you that you read our rules on legal validation. They are very useful for you to understand even better, even further, the process of validation. Validation, of course, is required for all beneficiaries and linked third parties. And please keep in mind that for PICs of third parties, which are frequently included in the consortium during the gap, they must be introduced in the grant management services system. And now we are at the point where we discuss the legal validation. And the legal entity validation comprises two distinct actions. The first one is the verification that the participant exists as legal entity and that the participant's data is correct. And secondly, the second action refers to the verification of certain special legal statuses that are used in the EU funding programs. And for you, I introduced here the definition of a legal entity, which is any natural or legal person created and recognized as such under national or international law. It must have legal personality and, acting in its own name, be able to exercise rights and be subject to obligations. In case an organization does not have legal personality, it is validated if there are two conditions met. The first one is to have representatives which have the capacity to undertake legal obligations on its behalf. And the second one is that it can offer equivalent guarantees for the protection of the EU financial interests as a legal person, in particular equivalent financial and operational capacity. In case the organization does not have its own independent legal personality and does not meet the above criteria, then this organization has to use the PIC of the legal entity to which it is associated. And here I gave you two examples. The first one on the university department that needs to use the PIC of the university, and of a branch of a multinational company that has to use actually the PIC of the company, of the parent company, of the mother organization. So this was the first component of the legal validation. And now we move on to the second one, which is the verification of the legal status. The supporting legal documents submitted by you also define the legal statuses of the participant. And why are these legal statuses important? And we can see here 2 points. The first one is that programs may have differences in terms of funding rates, like, for example, for a non-profit entity. Programs or calls may establish specific eligibility criteria, like being an SME or being a middle capitalization company. So we can see here on this slide that the legal statuses have extremely important legal and financial implications in your participation in specific procedures. And here, let's see which are the special legal statuses that we're talking about. So you can see private or public, non-profit or for-profit, SME, mid-cap enterprise, NGO, civil society, international organization, research organization, secondary and higher education establishment. Please keep in mind that some of these statuses are systematically checked and validated by the Central Validation Service. And these are private, public, non-profit and for-profit, and international organization, and one subtype of international organization, which is actually H2020, International Organization of European Interest. The others are actually based on self-declaration or on self-assessment. Let's see how you will receive in the participant register the requests from the Central Validation Service to actually upload legal documents in view of your legal validation and in view of your legal entity appointed representative validation. This slide you have already seen with my colleague Petros before, so this is how you can log in the participant register in order to modify your organization. And once you are viewing the information of your organization, of your specific PIC, this is how you will see the new messages that you will receive. So first of all, here you see a first message from the Central Validation Service with a request for documents, legal validation documents, and LIER validation documents. And the documents requests, for example, here it's a document, it's like a standard document request for a private entity. So you're requested to submit a registration FEL form, which is legal entity form, and the statute in order to confirm the data that you have actually registered in the participant register. Then you can just add the new document that you need to in order to proceed with the validation. Now, a couple of words about these documents that we are actually asking you for the legal validation. First of all, we're asking for a legal entity form. And for this legal entity form, there is a template in the DigiBudget website, and this needs to be completed, dated, stamped, and signed by you. Then we're asking for a VAT extract that has to be recent, not older than 6 months, and a registration extract that, again, has to be not older than 6 months, recent, and this is for private law bodies. For public law bodies, we're asking a law decree decision. Then for an international organization, we're usually asking for a copy of the international treaty. And in order to confirm the non-profit status, we're actually asking for the status. These documents, they need to be official, which means that they need to be delivered by official national authorities. They cannot be replaced by self-declarations or by sworn or solemn statements before a judicial or administrative authority, notaries or public officers. So they have to be official. Uploaded by you as scanned versions via the participant register, and in any of the official languages. A free translation in English is required for non-EU languages. And now we move on to the next section that actually refers to the appointment of the LIER. Once again, LIER stands for Legal Entity Appointed Representative. And maybe before I start with this slide, I will just add that there is a difference between what we call the legal representative of the organization and the appointed LIER, the appointed legal entity appointed representative. So the legal representative is actually the person who can commit legally the organization, who has the legal authority to engage the organization in its entirety. So that's the legal representative of the organization, so of a company. It could be the CEO of a company. It could be the minister of a ministry, for example. These are, straightforward cases for who is the legal representative of a specific entity that we are validating. And in order for us to confirm the role of the legal representative of your organization, so once again, the person who can commit your organization legally, we're asking for official documents that indicate clearly this specific person and also the role of this specific person in your organization. Like, for example, we might be asking for the act of appointment of the legal representative in your specific organization. But now we will discuss, so we will focus on the LIER, the legal entity appointed representative. So in CEDIA, the appointment of the LIER is mandatory. So you need to have also the LIER appointed. So your PIC, your organization, needs to be legally validated and to have a LIER appointed. What does the LIER do? The LIER keeps an overview of all the proposals, projects, contracts that your organization is involved in. It manages all the legal and financial information about your organization. It manages the access rights at organization level and appoints the persons which will be able to electronically sign grants and contracts, well, L-sign, and also cost claims and invoices, F-sign. These concepts have already been discussed by Petros, by the colleague who presented before. Very importantly, you remember we were discussing about the self-registrant, which is our contact point before and throughout the validation process. So the self-registrant can actually appoint backups, so there could be more self-registrants. Once the LEAR is appointed on the basis of the documents submitted by you, by the participants, the LEAR becomes our official, trusted contact point for post-validation modification requests. And the LEAR can also appoint backups, which means specific persons that can actually have access to the profile in the participant register. And these persons are called account administrators. So in case the LEAR leaves the company or there is something wrong with with his or her email address, then there will be someone else, an account administrator, who will actually have access to your organization in the participant register. The account administrators have the same access rights, except for the fact that they cannot assign roles into the system, roles into the chain of the project management workflow. And let's see, how we are actually requesting you in the participant register the LEAR documents. And here you can see that this section is called authorized users / LEAR. So before validation, our contact is the self-registrant. After validation, it is the LEAR. And here you can see two self-registrants. So there is a self-registrant and a backup. And once we have sent you the request for the LEAR appointment, there is a button, Add LEAR. And again, there are some steps that you actually need to take in order to introduce the requested data and upload the requested documents. The first step refers to the LEAR EU login. And this is actually very important because the name and the email of the LEAR should actually match the name and the email of the linked EU login account. So this is the first step. Then you can introduce the LEAR data. This is the name, the first name, the last name, and then the mobile phone number. And we actually recommend to you that you introduce here the mobile phone number in order to receive your PIN that actually gives you access to the profile in the participant register. So once your LEAR is appointed, he or she needs to receive a PIN code. This PIN code is normally received, sent by our service desk by post. However, if there is an urgent request, you can always send an email to this email address here. Or if you provide your mobile phone number, then we will send it to you to this phone number that you have provided. And this is our only use for your mobile phone number, not for any other uses. So it is actually recommended that you introduce your mobile phone number in the participant register once you introduce the data regarding the legal appointed representative. And the third step refers to the legal representative data. You remember, we've just discussed the difference between what is a legal representative and what is a legal entity appointed representative. And this is actually the moment when you have to introduce your legal representative data. Of course, you can see that they can be the same person, but it really depends. It really depends on how you want to organize yourself for the appointment of the LEAR. So it is actually the legal representative who appoints the LEAR. And here we need to know the details about the legal representative of your organization. And finally, we move on to the last step that refers to the LEAR appointment documents. And these are some documents that you actually need to fill in. The first one is the LEAR appointment letter and roles of duties. The second one is a declaration of consent to the EU funding and tenders portal. And finally, we're asking for official proofs of identity for both your legal representative and the appointed LEAR, and proof of empowerment of the legal representative. So proof of empowerment of the person who can commit the organization legally. The scanned version of these documents shall be uploaded in the participant register. So just like for the legal validation documents, you can upload everything in the participant register. And the originals of the LEAR templates, so the originals of the LEAR appointment letter and roles of duties and the declaration of consent, they must be kept in your entity's premises for possible checks or verifications. And this is how the request for the LEAR appointment documents looks like in the participant register. So you will just have to, you have here the generated LEAR templates that you need to fill in and correctly sign. So you need to pay attention on how you sign the document. So where the legal representative signs and where the appointed legal entity appointed representative signs. And you just have to upload the requested documents. And with this, yes, we finalize the section on the LEAR and we move on to the bank accounts. If needed during the gap, you can search for available bank accounts in the grant management services system. If no account exists, the system displays an explanatory message on how to request the validation of a bank account. And participants should start the bank account workflow by uploading the requested documents via the participant register. So just like for the legal entity validation workflow, and then for the legal entity appointed representative validation workflow, there is a section in the participant register where you need to go, introduce the requested information and upload the requested documents. So the Central Validation Service will launch the BA validation and we will inform you once validated. And this is how the participant register looks like. So you can see here that we have gone through these tabs. So the organization data, then the legal information for legal validation, authorized users and the LEARs. And now we are looking at bank accounts of this tab here, of this section on bank accounts. And then my colleague Alberto will take you through the financial capacity tab. And these are the steps that you need to follow in order to introduce the requested data for the bank account validation. So first of all, the bank account, then the account holder's details, and you need to upload the requested documents, and then of course to confirm, and you can submit your request. And now I will give the floor to my colleague Alberto that will take you through the financial capacity assessment process.
Thank you, Alina. Good morning. My name is Alberto from the Central Validation Service, and we are going to see together what the financial capacity assessment is. As we are going to see in the slide with the overview, here it is, the financial capacity assessment is not checked in all organizations. So we are going to see also when it's needed and what to do if it is. Let's start then by some legal references that we are going to see in the next slide. First of all, we have the rules on legal entity validation, LEAR appointment and financial capacity assessment that you should read, because they include all the details on the procedure for the validation of one organization and for the preparation of the financial capacity assessment, documents, requirements, specific cases, etc. You will find this document for consultation in the Funding and Tenders portal, but also you will find a hyperlink at the end of this presentation. Then we have the EU financial regulation, establishing the need of the financial capacity assessment, the exempted entities, and the documents to submit. Finally, the Horizon Europe regulation, in its Article 27, establishes the organization subject to financial capacity assessment, which are mainly coordinators. if the requested funding for an action is equal to or greater than 500,000 euros. But also, coordinators below that threshold and other beneficiaries might be checked if there are grounds to doubt about their financial capacity in the action. As previously mentioned, there are some exempted entities, which are public bodies, international organizations, natural persons in receipt of education support, and natural persons in need. In any case, if the financial capacity assessment of your organization must be checked, we will contact directly you via your PIC account in the participant register. But also, the appointed LIAR will receive one email. Let's see now in the next slide how to identify in the participant register if we have received such request. As previously explained by Alina, by entering in the participant register, my organization, then modify organization, we will find some tabs, and the one called messages will display a red dot, meaning that we have received a new message with a request. And we will identify that this request is in relation to the financial capacity assessment because the subject of the message will include financial capacity assessment request for documents. We will have access to the content of this message by clicking the view icon we see on the right side of the slide. And by clicking there, we will see that this message contains instructions to follow, the rules of the financial capacity assessment, the documents we must provide, the minimum content and requirements of these documents, and the deadline to submit them in the participant register. This deadline is normally 1 week. And if you don't provide the documents in that period of time, we will send 2 subsequent reminders. Of course, if at any time during the procedure you have questions, you need further clarifications, you can always contact us via the official channel of communication, which is the participant register, by sending us a message, using the functionality we see there on the right, new message. What is important is that you include in the subject of your message financial capacity assessment. Like that, it will be easier to trace. So now, let's see the supporting documents. The supporting documents we need to provide, if requested, via the previous message, are balance sheet and profit and loss account for the 2 most recent closed and approved financial years. These documents must be in the official language in which they have been submitted to the national authorities. They must be dated and signed. Very important, the signature. In relation to the language, if the financial statements have been drafted in a non-EU language, also an informal translation into English must be submitted. On the contrary, if your organization is a new established entity without financial statements yet, you must provide a business plan, including financial projections on the first year of activity at least. In addition to the financial statements, if the organization subject to financial capacity assessment has requested more than 750,000 euros, they must provide an external audit report on the annual accounts. If by national or EU law, the organization is not obliged to prepare an audit report, to produce an audit report, then they must submit instead a self-declaration. This self-declaration certifies the validity of the accounts. It's a template that is available in the participant register, but also in the message request for documents you find in the message section. You will find the hyperlink to this template, and very important, this template must be duly filled in and signed by the legal representative. Another supporting document, the explanatory notes. This document is very, very important to provide because it gives additional details not included in the balance sheet and profit and loss account in terms of nature of maturity of some accounting items. So it's important to provide because if there are some missing information in the balance sheet and profit and loss account, and we don't have the explanatory notes, we are going to apply a prudent approach that could have a negative impact in the outcome of the financial capacity assessment. So please, it's very important that you provide together with the balance sheet and the profit and loss account the explanatory notes on the annual accounts. Now that we know the documents we must provide, let's see in the next slide how to upload it in the system, how to upload them in the system. And we do that back in the participant register in the financial capacity tab. As we can see, this tab is displaying a red flag that will be there from the moment in which we receive the request for the financial capacity assessment. Then, as we can see in the lower part of the slide, the status is data required. And also there is one action to be taken, which is provide necessary financial information in the blue button we see on the right side. So this is very important. The financial documents, the documents in relation to the financial capacity assessment must be uploaded by clicking this blue button. Then once we do it, we upload the documents in the system and the red flag will automatically disappear. Of course, if we need additional documents or further clarification, we will come back to you via message, again via participant register, and you will see it in the message section. So that's all in relation to the financial capacity assessment. Now my colleague Alina will close the presentation. Thank you for your attention, and I will be available for questions at the end of the presentation. Thank you.
Thank you so much, Alberto. On this slide here, we just wanted you to visualize how we're actually interacting with you. You can see that we are sending you requests for documents and requests for clarification once we start the validation. However, if on your side you're non-responsive, then you will be set into what we call a sleeping status in the participant register. Once you are set in sleeping status, then we will inform the operational unit and you will have to actually upload the correct requested documents. And once you do that, we can continue the validation and your sleeping status will be removed. You will be reactivated in the participant register. Your PIC will be reactivated in the participant register. And well, as you can see on our side, once we have the complete and the correct set of documents, then the validation process goes really smoothly. However, if we don't have the complete and the correct documents, then the process may take a long time. You can see here in the green box that we have set for you the 3 strands of validation that we're talking about today. So the legal validation, LEAR validation, and FCA preparation. And please keep in mind that we can start the work for the 3 strands of validation once we have the documents. So at the very beginning of the process, if we have the submitted documents on your side for the 3 strands, we can begin to work on the validation. However, we can only appoint the LEAR once your PIC becomes valid. This you need to keep in mind. And finally, we will talk about the communication of the REA Central Validation Service with you. Very important. All the communication is exclusively managed through the participant register. So the participant register is the official channel of communication with the Central Validation Service. And this is how you will receive the messages from us, the notifications via email, so to the contact person before validation, the self-register, and then after validation, the appointed LEAR. And this is one final important aspect that might be very useful to you. In case you lose access to a non-valid PIC, which means that the self-registrant left the organization and no one else has access to a non-valid PIC, then you need to create a new PIC in the participant register, and we need to be informed. If you lose access to a valid PIC, to an already valid PIC, because some of your PICs may be already valid because you've participated in previous calls, then if the LEAR is not available anymore and there are no account administrator, then a new LEAR needs to be appointed through a LEAR recovery procedure. And you have here the hyperlink that you can follow. These are the guidance documents that we promised you at the very beginning that you can consult in order to find out more about the validation process. And this is my last slide. It's a geographical distribution of entities that we validated in 2021. You can see that we validated entities from around 146 countries last year. Thank you very much for your attention, and we will be taking your questions now.
Indeed, we are now going to the question and answer session. And I will read out the questions, again following the order of priority, and I will then give you the floor for replying. So, highest voted question. What information, oh, this is still a question not related to this part.
Yes,
so maybe we skip it, and the next one also not.
Yes.
And the next one also not.
Yes.
Colleagues, can you bring up the questions related to... Okay, now I see one. Do associated partners need to undergo the validation process? Please.
Yes, we usually validate all the members of the consortium. So we usually receive the validation requests from your side, so I mean from the operational services side, and once we receive the list of PICs from you, then we will start the validation process. So I would say we need validation for all the members of the consortium.
A slight correction here for the associated partners who are not beneficiaries and who do not sign the grant agreement. Validation is actually not required, not obligatory. Okay, next question. Again, this is not related to the subject, and the next one not either. And the next one neither, but I see one down there. Can you scroll further down? Because I don't see questions related to legal entity validation and financial capacity check. Colleagues, can you scroll further down? Okay, maybe I see the one that has, for the moment, 0 votes, but because we are stuck a bit, I take this one. Can a natural person obtain a PIC and be a beneficiary? Please, colleagues.
Yes, absolutely. A natural person can actually register in the participant register with a PIC, and we are also requesting for the legal documents in order to validate. So the process basically has the same steps. And we are talking here about self-employed persons, and we are requesting for the legal documents for the natural person and for the LEAR documents.
Okay. I see again only a question that has not votes yet, but let's take this one. If the validation process started 2 weeks ago and documents were uploaded on time, but there is no answer yet and deadline is approaching, what can be done? Please, colleagues.
The validation process started 2 weeks ago, were uploaded on time, and deadline is approaching. Well, deadline, okay, could not be approaching if documents were uploaded 2 weeks ago, because I mean we start the process of validation once you start the gap. So basically, once the gap starts, we're also starting the validation process, which means that we are sending you a request for documents through the participant register, as we have seen in the presentation, and you have to upload the documents on your site. If the documents are received through the participant register, then we will start the validation process as soon as possible if we are notified by the operational services.
Okay.
So we will
you.
start validation as soon as possible. It could be, I mean, it could be a specific, example. I can look into it if you can give me the PIC number. I can look into it. But I mean, we start validation as soon as possible as we receive the validation documents.
Okay, now I see a few questions with votes. How long should it take to become verified? We have a declaration signing deadline of 1st of February and are still not validated despite submitting everything.
Yes, as I said, we actually start validation once you start the gap. The signing of the Declaration of Honor is an internal deadline, I would say, for you during the gap, but it's not the deadline for you to be validated. Officially, we have 25 days since actually receiving the documents, the legal documents, to finish the validation process. But as I said, once we receive the complete and then the correct set of documents, we can start validation and then the process can go smoothly. So the process of validation and then assessment and verification of documents.
Okay, thanks. Next one, a university hospital is at the same time a faculty of medicine of a university besides being an independent hospital. Can the hospital register for its own PIC?
Yes, this seems to be a very specific case, and we need to look into the documents submitted by the participants to see if this entity has independent legal personality and can be validated in the participant register.
So I look through the questions, whether there are still some. Yes, I see the next one. For the financial capacity assessment, how is COVID impacts on year accounts taken into account?
Well, that's a good question. Well, during my presentation, I was highlighting the need of providing the notes on the accounts. So it's very important that you include, when preparing the 2021 accounts, you include in the notes all the effects, let's say, all the difficulties the organization has faced as a result of the pandemic. Because depending on the information included there, and the way in which the pandemic has affected the normal activity of the organization, we will analyze and we will prepare the financial capacity assessment. So it's really case by case and depending on the information included in the notes on the account. So it's very, very important that you explain clearly there in which way the pandemic has affected the results of the company and the normal activity of the company in comparison with the period previous the pandemic.
Okay, I'm looking at my watch and I take one last question on this subject. Can old wrong PICs be deleted to avoid mistakes? Alina, I guess you will reply.
Yes, in case you are aware that you have 2 or more PICs for the same entity registered, let's say by mistake in the participant register, you can always send us a message through the participant register. So through one of the PICs or through the PIC that needs actually to be, let's say, made inactive in the participant register, and then we will link the 2 PICs. We will link the 2 PICs into what we call a master PIC, which becomes the active PIC and then the correct PIC that you have to use for your participations in the participant register. So we don't delete it per se, but we just make the PIC inactive in the participant register.
Okay, thank you very much. I think we stop here and we have now 7 minutes for a very short coffee break and we will be back soon. Thank you very much so far. I hope you can hear me again. So I hope everybody enjoyed the very short coffee break. We will continue in our agenda, and the next presentation will be about more details on how to transform the technical annex of your proposal into the so-called Annex 1 of your grant agreement, which is the technical description of your project. And this presentation will be given by my colleague Isabel Vergara. Please, Isabel, take over.
Thank you, Peter. Good morning. I hope you can hear me well. Yes, so thank you. So this will be a second part of Petros' presentation this morning, and I will concentrate in the instructions on how to generate the description of the action, which is the Annex 1 to the grant agreement. And I will also go through the screenshots and the steps in the IT tool that you have to follow. So I will cover these 3 points in my presentation. So first, I will give you a short introduction on the grant agreement preparation process. So it's kind of repetition of what Petros presented this morning. I will give you the template for the description of the action that is actually not a template, but a series of instructions that we offer to you on how to generate this document. And then the bulk part of the slides are dedicated to show you how to work in the IT tool, in the grant management IT tool. So for the introduction to the grant agreement preparation, I think Petros presented this graphic this morning. So I want only to highlight that in Horizon Europe we have time to inform maximum of 5 months, and this is the time that goes from the call deadline to the moment you receive the results of the evaluation, and that we have a target for the time to grant of a maximum of 8 months, and this is the time that goes from the call deadline to the grant signature. So meaning that for the grant agreement preparation, we dedicate a maximum of 3 months. And Petros already mentioned this morning that in the letter, when we invite you to start grant agreement preparation, we give you very short deadlines that you will see that are sorted at these 3 months that we show here. But I also would like to highlight that once we finish the grant agreement preparation with you, our discussions with you, we still have to do a lot of internal work to prepare the award decisions, internal documents, the budgetary commitment to sign the grant, and in particular, for some grants, we also have to ask the opinion of the program committee, so the member states, and this takes time. So this is the reason. In many cases, when you finish the grant preparation process from your side, it will take still some time for us to react. And the reason is because we are doing some internal work, and in some cases also consulting with the member states, with the program committee members. And this is what Petros saw this morning, and this is what I have just explained is what it will be covered from this, from the rest of time. So in these weeks that we saw to you until the maximum of 3 months. So then I would also want to highlight in this introduction that the grant agreement preparation phase is the phase in which we collect all the information that we need to generate the grant agreement. And this includes the technical specifications coming from the proposal, also the participants, but also some other legal and financial and administrative information that in many cases is something that the project officer has to do in the system. So the combination of the information that we receive from you, from the consortium, and the information that the project officer has to encode in the system, so we generate the grant agreement that will consist in a data sheet. This is new in Horizon Europe. It is a short summary of all the conditions that are important for the implementation of the grant, plus the core of the grant agreement, and then we will have the annexes. The Annex 1 is the description of the action, is the project description, And Annex 2 is the estimated budget. And then we have a number of other annexes, including templates, the templates that you have to use for the Declaration of Honor, for the CFS, and also important for you to know that all the specific rules for Horizon Europe are included in the Annex 5. So far for the introduction to the grant agreement preparation and for the description of the action. So what I already mentioned is that this is the Annex 1 to the grant agreement. So it's fully part of the grant agreement. So it has to be respected as any other article of the grant agreement. It contains the details on how the project will be carried out. These details are coming from the proposal, and it follows the same structure as the proposal. So it includes two parts, Part A and Part B. Part A is automatically generated by the system with the information that you encode in the grant management system. And Part B is the narrative description of the work. And this is mirroring the Part B of the proposal template with some changes that I will explain later, and must be uploaded as a PDF document. When you are invited to start the grant agreement preparation, you will be able to download the description of the action template, which is, we call it a template, but it's not actually a template because it includes the instructions that you have to follow in order to convert your proposal document into the description of the action, the Part B. So the Part A includes the cover page, the table of contents, project summary, list of participants, list of work packages, and this is one of the changes because the list of work packages in the proposal was included in the Part B. In the description of the action is Part A, and the same for the rest. So for the staff effort, list of deliverables, list of milestones, and list of critical risk. You should not change anything from the proposal. So as explained by Petros this morning, so we follow a no negotiation approach. We take the proposal as it is. And we also don't expect that when you encode this information in the grant management system, you just copy the information from the proposal. Because for the Part B, indeed, we is a document in which we explain, you explain how the project will be carried out, and it follows, or it should contain the same information as the Part B of the proposal. However, because there are tables now that are included in the Part A, because we have it in a structured way in order to be able to follow up the projects in a better way, then what we are asking you is to remove those tables from the Part B of the proposal. So actually, these are detailed instructions of what you have to do in order to modify the Part B of your proposal and to make a Part B of the description of the action. So important, you need to start with the Part B of the proposal that you submitted, no previous version. So the proposal, the version that you submitted, you need to remove the cover page, you need to delete the header and replace the footer with another footer that includes, is almost the same footer as the proposal, but includes the Part B here. You have to remove the list of participants because it's now included in Part A, and then remove all those tables that are mentioned that are included in a structured way in the Part A. This is also a new thing, and we hope that it will be temporary until we have a technical solution. So for the time being, we are not able to translate the information on the ethics self-assessment that is included in the proposal Part A into the grant management system. So for the time being, what we are asking you is to create a section 4 with the ethics self-assessment that you included in proposal Part A. This we hope that we will be able to change in the coming months. Then we ask you to add a table with the history of changes. Please clarify what changes you have done in comparison with the proposal, and also try to justify why those changes are needed. And finally, we ask you to add or update the table of contents. as explained also by Petros this morning, you should discuss with the project officer in charge of the grant agreement preparation all the changes that you include in comparison with the proposal. And then I also repeat here some points that were mentioned by Petros this morning. So there are important points that you need to take into consideration. So it might happen that when you receive the evaluation result letters and you are invited to the grant preparation stage, so you can already work in the grant management system, the ethics review of the proposal is not finished. If this happened, you will receive later on a different letter with the results of the ethics review. And in this letter, it might be explained to you that you have to fulfill some ethics requirements. And if this is the case, of course, you have to pay attention to this. You may even have to change some information in the Part B of the proposal answering these ethics requirements. And it might be also that some of these ethics requirements must be fulfilled before the grant agreement signature. So you need to pay attention to this. And similarly, for security scrutiny, in case your proposal is fully reviewed for security scrutiny, it might be also security requirements that you need to consider. And as explained, please avoid repetition. So it's very important that you really remove the tables that are now part of the Part A and are no longer part of the Part B. This is important because in the case of amendments, if there are information repeated in the two parts, it might happen, and this has happened in the past very often, you change in the information in one of the parts, but not in the other, and then later on we cannot say which information is the one applicable. Okay, so far with these points about the description of the action, and then I will go through all the steps in the IT tool system, in the grant management system that you have to work with. So as explained by Petros, so the first is to enter into the portal. You log in and then you click in My Proposals, and then you will have the list of the proposals that you have submitted. And then under Actions, you need to click in Manage Project. When you do this, you enter into the Grant Management Service, in which if the proposal has been invited to start grant agreement preparation, you will see a similar screen like this. And then Peter explained all the details in this screen, but in order to start working in the grant agreement data, you have to click in this link, and then you enter in another system that we call Sigma, where you